The first time I ever went to a developing country was 20 years ago, and the place was Guayaquil, Ecuador. I arrived at the Isla Trinitaria. 300,000 people living in shanties on the River Guayas. As I walked around the Isla Trinitaria, I saw shanties built over the Guayas River basin on stilts. You had to walk over boards to get to them. There was no sanitation. The Guayas River underneath the houses was their latrine. And you could see children playing in that contaminated water. That's part of the reason why the child mortality rate was high. That's where I met Father Frank Smith, a Mill Hill missionary priest from England who had dedicated himself to helping the poorest of the poor.
They asked me to go to Ecuador and find a place that would be suitable for missionary work. And I came here, and then I came to Guayaquil and saw those big 5 slums and decided this is it.
Here in the parish of St. Rose of Lima, in the Isla Trinitaria, the big slum of Guayaquil, we have a school with 184 children, ages from 4 to 12. In addition to the school, we also have the clinic, which is called St. Rose of Lima.
When we first started here, there was no other clinic, and we had 80 patients a day, sometimes 90, absolutely overwhelming. We decided to walk all through the slum, visit the houses, get to know the people, and in that way we jotted down patients at this street and that street and so forth. So we were well known as a team, medical team. Once a month the doctor and the nurses go into the school, into the classrooms, and they give to the children anti-parasite drugs and also vitamins. And the kids are generally very healthy.
We're standing on the bridge which links the Isla Trinitaria with Guayaquil, the city. You can see a number of slums. Just on the left you get the Isla Trinitaria, which I calculate has 300,000 people.
The people that live on the isla come from different parts of Ecuador, and it's usually a last resort for them. They come to the isla because they have nowhere else to go. They're homeless. They're hoping to find some sort of work in Guayaquil as a street vendor, selling whatever they can. Most of them living on less than $1 a day. They struggle for food. They have so little money that they face difficult choices of survival every day of their lives. They're trying to decide how to help their children to survive. It's a very difficult place to be a parent.
Yo me llamo Anita María Domínguez Yaguar y vivo en esta casa con un solo dormitorio entre todos mis hijos. Tengo 8 hijos y con todo vivo con todos mis hijos ahí. En una sola nomás yo estoy ahí viviendo. No tengo cuarto dividido para nada. Una sola nomás vivimos entre todos. Yo no tengo dónde estar, dónde vivir, así. Ellos nomás que andan hacia el río y ahí me gusta que tener una estación, una casa para ver que donde lleguen ellos, estar viviendo estable ahí. Así que quiero ser.
The experiences I had on this first trip to Ecuador convinced me that providing some basic medicines and basic health care to this community could make a life and death difference to many of the children. It was here that the idea for Medicines for Humanity was conceived. There was very little access to basic medicines and to basic primary health care. Many of the children face threats from diarrhea and dehydration, respiratory illness, acute respiratory infection, things like pneumonia and asthma, and malnutrition, which is perhaps the most pervasive problem on the isla. Those are some of the health problems worldwide that take the lives of more than 9 million children under 5 years old each year. And those are the things that are still impacting the Isla Trinitaria and that Medicines for Humanity is trying to eliminate.
That original idea that Tim had, which began in Ecuador, has really become a sophisticated organization with major impact around the world. Medicines for Humanity's mission is to reduce child mortality. And right now we have 17 projects in 10 countries, including the Isla Trinitaria in Guayaquil, Ecuador. To do this work, Medicines for Humanity focuses on 4 different areas. Nutrition, which would include access to food as well as clean water, access to clinical care and the basic medicines to treat very simple diseases, access to health care, and access to health education for women in particular, and also the education of the health promoters in the individual communities. And here's how we do it. The donations that we receive are sent directly to our program partners on the ground to be used in their local communities. In Ecuador, these funds are used to actually purchase the medicines that are being distributed in the clinic, as well as paying the salaries of the physicians working there.
Our pharmacy is very small, and we are short on medicines. We go through a lot of medicines, and we demand on, we rely on help for to buy them.
The diseases that kill children in Ecuador are respiratory illness, malnutrition, and dehydration or diarrhea. And something as simple as ampicillin that we go down the corner drugstore and buy is a lifesaver in Ecuador. The cost of this bottle is $2.70.
The first check I ever wrote, I got a thank you note saying I had saved hundreds of children's lives. And I do a lot of philanthropy. I think there's no shortage of worthy causes, but this was one that really kind of threw me back. I said, wait a minute, I've written a lot of checks, but I haven't had that kind of response.
I've seen in 20 years tremendous progress. When we first started, no doctor wanted to come here. There's no money in it. And it's thanks to Medicines for Humanity that they now pay the doctors' wages. And the doctors are enthusiastic, they come and they will stay. And I feel very, very grateful for that because it makes such a difference. If I look at the children's eyes, I see a desire for improving themselves, a chance to be loved, and a chance to grow up, and a chance to be somebody.
It's great to have seen the organization grow so dramatically just over the last 3 to 5 years, spanning the globe, if you will, now from South America, Latin America, all the way to Africa. The one thing we know is there's no shortage of need out there. We're trying to do our part to treat and get involved with as many people as we can with the right partners. And we are now treating over 300,000 children per year. You're not going to find a more worthy cause to invest your time and money, because you will get such an unbelievable psychic, emotional return on your investment from how many lives we are saving with the use of basic medicines purchased very inexpensively, and the educational programs, postnatal, prenatal, that we are able to provide.
Real compassion is when you say, I want to do something. And somebody might say, well, I can't go to the missions, I'm sorry, I've got my family, I've got my job, but I'm willing to help those who say we will try to eradicate malnutrition and save children, babies from dying. And that to me is the real compassion that is the basis of my work here in Ecuador.
20 years later, Father Frank Smith is still working on the Isla Trinitaria, making a life and death difference to the families in this community, and so is Medicines for Humanity.